This is a training video for the administration of alteplase for unblocking of tunneled dialysis catheter. Although the video may talk about urokinase instead, the steps are similar and we will highlight the key differences for alteplase at key junctures.
Urokinase administration is done for poor flow or blocked tunneled dialysis catheters. Before we begin, prepare the following items: a sterile dressing set, sterile gloves, hexodane solution, 10 ml syringe times 3, 1 3 ml syringe, 2 needles, 2 cap bungs, 1 valve of urokinase, 60,000 units per valve, 2 valves of normal saline, and 1 valve of concentrated heparin, 5,000 units per ml. Next, prepare your gauze. Soak at least 4 pieces of gauze into the hexodane. This will help during your sterilizing of the perm cath or tunneled dialysis catheter caps and clamps. Subsequently, open up your green towel and drape it over your patient's tunneled dialysis catheter as so. Proceed to take out one of the pot and clean both the cap and the clamp using your sterile gauze that is soaked in hexodane. Clean the cap and discard the cap. Subsequently, with a gauze, with a cotton ball, clean the tip of the perm cath catheter at least 10 times each direction, both clockwise and anti-clockwise directions. Do not forget to clean the clamp with your other sterile gauze. Repeat the procedure for your other pot. Next, with a 10 ml syringe, attempt to aspirate from both pots. You should try to aspirate at least 2 ml of blood per pot. If unable to aspirate, test the other pot. If you are unable to aspirate, attempt to flush both pots with saline. Fill your syringe with saline. And attempt to flush it with saline. If able to flush, you will subsequently move on to administering of urokinase. However, if you are unable to flush both pots, you have to arrange for an exchange of the tunneled dialysis catheter at the IR department. Next, we shall go on to reconstituting the urokinase.
Instead of urokinase, ED staff will use alteplase 2 mg times 2 valves for unblocking of tunneled dialysis catheter. Check the volume of each catheter lumen indicated on each pot. Each lumen will require 2 mg of alteplase to be injected into it, i.e. 1 valve for 1 lumen. Using a 3 ml syringe, dilute the alteplase with the corresponding volume of each lumen pot using water for injection. You will need 2 times 3 ml syringes for both valves of alteplase.
Proceed to administer the urokinase, the volume accordingly to each pot. After administering of the urokinase, you must subsequently cap the administered pot with new caps and cover the perm cap with your sterile towel. Advise the patient to lie in bed for the next 1 hour until you return to assess the patency of the pores. We return to the patient after 1 hour. Before we go back to the patient, ensure you have the following equipment available: at least 3 10mm syringe, 2 5mm syringe, 2 new caps, and a green needle. And similarly, your sterile set with gauze and hexodane soaked cotton. We shall again begin by preparing your gauze that is soaked in hexodane so that we can clean your perm caps and clamps before we start. Next, we go back to the patient. Open up the dressing set or the sterile cloth. Again, before we start, we shall remember to clean both the caps and the clamps of the pores. This is extremely important to ensure that the patient does not get an line sepsis, which can be fatal or require long duration of antibiotic treatment. Similarly, clean the second port. Next, use your 5mm syringe and attempt to aspirate the urokinase out from the port. Aspirate at least 2 mL of blood to ensure that all the urokinase has been removed. Discard the syringe. Using your second 5mm syringe, attempt to do a similar thing and aspirate at least 2 mL of blood from the other port. Do not return this blood to the patient. Now we shall go on to test the blood flow of each port. Using a 10mm syringe, attempt to aspirate and flush the blood at the same time. Blood must be able to draw smoothly and fill the syringe within 2 to 3 seconds. If the blood flow is not smooth or patent, you might have to reconstitute a urokinase and administer a second round. You may return this blood to the patient. Similarly, test the flow for the second port. The flow should be smooth such that the syringe fills itself up within 2 to 3 seconds. Once you have ascertained that your perm caps are both patent and valid, the next step is to ensure that we heparin lock the ports before we cap them. Using your 10mm syringe, draw 1 ml of heparin from your heparin valve, which constitute 1 ml. Before we administer your heparin, do remember to flush your ports with saline before you administer your heparin. We will now flush both ports with saline. And then subsequently administer the heparin. Similarly for the venous port. Before we cap off, remember to clean the ports of the lumen with cotton soaked in hexodane to ensure sterility. And replace with new caps. And we are done.